Time now for Morning Rounds, our look at the medical news of the week. First up, antibiotics can be highly effective when used to fight bacterial infections. But overprescribing and misprescribing the drugs has created a public health problem.
This week, the American Medical Association published research analyzing and comparing the antibiotic prescribing rates of various medical outlets, including those retail clinics, urgent care centers, medical offices, and emergency departments. Here to go over this study and more is CBS News medical contributor Dr. Narula. Thank you for joining us. So, in comparing these rates, what did we find?
Well, we found something interesting, which is that we tend to think about antibiotic prescriptions or overprescription coming from emergency rooms and medical offices. But actually, there's a growing sector that's often under-recognized, and that is urgent care clinics and retail clinics. Retail clinics found in pharmacies and grocery stores. Urgent care clinics, we know that there's over 10,000 high-volume centers in the United States. These are areas where we're seeing lots of antibiotic prescriptions being given out. And when researchers really looked at how many times the antibiotics are being given for sort of inappropriate respiratory diagnoses, it was most often in urgent care centers. It was 3 times more often in urgent care centers than medical offices, 2 times more often than in emergency rooms.
Did we know why?
You know, I think a lot of people go to urgent care centers with the expectation that they might get a prescription. Their primary care doctor's not there, who they have a relationship with, who can really tell them, you know what, this isn't something that needs it, you can hold off. And then there is something called the Yelp effect that has been written about, which is the idea that we live in an environment of social media where a lot of businesses and doctors are impacted by reviews. And the last thing that a lot of businesses want is for somebody to write a review saying, I went and I didn't get the Z-Pack or the antibiotic that I got, that I expected.
A couple of years ago, Tara, the CDC said nearly 30% of all antibiotic prescriptions were unnecessary. So what sort of public health problems does that create?
It can create a big one. We're talking about 80 million prescriptions a year that are inappropriate of antibiotics.
Wow.
And the situations that can come from this, people can have allergic reactions to antibiotics that they didn't know they had an allergy to. They can kill off good or healthy bacteria that can lead to illnesses like C. diff, which is a diarrheal infection that can become deadly. It can lead to increased medical costs, increased hospital stays or lengths of stay, and increased mortality. And what most concerns me is that patients that are most vulnerable, those who need chemotherapy, organ transplant patients, surgical patients, burn and trauma patients, may lose a really vital tool of antibiotics if there's resistance that develops. And it's really that resistance that we worry a lot about.
The Washington Post wrote about this. In fact, they said that urgent care doctors and owners worry about what this Yelp effect, and if doctors, when they see patients, you mentioned this earlier.
Right, and I think what we need to do is really set expectations, and that's why stuff like this is important in terms of educating people that not every time you go do you need an antibiotic, and there need to be that open line of communication with the doctor, and also the doctor can take time to really educate on what else you can use besides an antibiotic to make you feel better.
All right, our next topic, the rising rates of heart attack during pregnancy. Research published by the Mayo Clinic looked at U.S. hospital data from 2002 to 2014. Their analysis found that for women hospitalized during and soon after pregnancy, heart attacks occurred in roughly 1 out of every 12,000 cases, with the rates actually increasing over that period. Why have they been going up, Tara?
Well, it's interesting. One of the things is that we're seeing more women have babies at advanced maternal age, and we know that that increased age can increase your risk for heart attack. In addition, there's been changing cardiovascular risk profiles over the last 10 or 15 years. We're seeing more hypertension, diabetes, obesity. We now have better testing, more sensitive blood tests that can pick up on heart attacks, and we're probably testing people more frequently, so that may be one of the reasons why we're diagnosing it more often. And there's more provider awareness. We are more aware now that this can happen, so we may be looking for it a little bit more.
Were these certain factors, did it make some women more at risk?
So certainly advanced maternal age, if you had pre-existing cardiovascular disease, or if you had risk factors like hypertension, diabetes, tobacco or drug abuse, anemia, or even malignancy or cancers. But one important thing to remember is that pregnancy in and of itself is really a state of increased risk for anyone. You have hormonal changes, hemodynamic changes in your cardiac output and your blood volume, and also it's a time where you're more prone to clotting. So all of this really increases the stress. We call it a stress test, really, on the body.
All right, finally, could playing video games actually help kids lose weight? A study led by researchers at Louisiana State University assigned 46 overweight children to a program of exergaming, or to a controlled group. Exergaming is the term for video games that demand physical movements of the body. After 24 weeks, they found that kids in the exergaming group had improved BMI scores and improved cardio health. The authors say exergaming combined with other activities could be seen as a viable way to lose weight.
The only exercise my son does when he's gaming is yelling.
No, I mean, you know, we know that a lot of our 6 to 11-year-olds are obese and they have early signs of cardiovascular disease. So more and more we're understanding that bringing technology to people, whether it's with fitness trackers, telehealth, or gaming, even though it sounds different from what we're used to, can be important ways to kind of improve fitness.
Yeah, but always what goes in the mouth is the key to weight loss.
Yes.
Dr. Narula, thank you so much.